Question 1. A 68-year-old male presents to the emergency department with sudden onset of severe chest pain radiating to his left arm. After diagnostic tests, he is diagnosed with an acute myocardial infarction. The patient also has a history of controlled hypertension and type 2 diabetes mellitus. Which condition should be coded as the principal diagnosis? A. Controlled hypertension. B. Type 2 diabetes mellitus. C. Acute myocardial infarction. D. Chest pain. Answer: C. Acute myocardial infarction. This question tests understanding of the principal diagnosis concept in ICD-10-CM coding for inpatient encounters. The keyword principal diagnosis refers to the condition established after study to be chiefly responsible for occasioning the admission of the patient to the hospital for care. While the patient has other chronic conditions, the acute myocardial infarction is the reason the patient was admitted and received care, making it the primary diagnosis. For example, if someone comes in with a broken leg, the broken leg is the principal diagnosis, not their existing high blood pressure. Always ask yourself, why was the patient admitted, when determining the principal diagnosis? Question 2. A patient undergoes an open appendectomy. What is the correct CPT code for this procedure? A. 44,950. B. 44,960. C. 44,970. D. 44,900. Answer: A. For 4950. This question evaluates the ability to locate the correct CPT code for a common surgical procedure. The keywords open appendectomy direct you to the digestive system section of the CPT manual. An open procedure means the surgeon made an incision rather than using a minimally invasive, laparoscopic technique. Code 44950 specifically describes an appendectomy performed via an open approach, which is the standard procedure for removing the appendix. When coding surgeries, always identify the anatomical site, the procedure performed, and the approach used to ensure the most accurate code selection. Question 3. What is the medical term for pain in the joint? A. Myalgia. B. Arthralgia. C. Neuralgia. D. Cephalgia. Answer: B. Arthralgia. This question assesses foundational medical terminology knowledge, specifically the suffix for pain and the root for joint. The keyword pain in the joint immediately points to combining the root arthro- meaning joint, with the suffix algia meaning pain. Myalgia refers to muscle pain, neuralgia is nerve pain, and cephalgia indicates headache. Understanding common prefixes, roots, and suffixes is crucial because it allows you to decipher complex medical terms and grasp their meaning. Question 4. A patient is admitted for a cardiac catheterization where a stent is placed in the left main coronary artery. In ICD-10-PCS, which route operation describes the stent placement? A. Dilation. B. Restriction. C. Insertion. D. Bypass. Answer: C. Insertion. This question tests knowledge of ICD-10-PCS route operations, a core concept for inpatient procedural coding. The keyword stent is placed as key here. A stent is a device that is put into a body part to maintain its patency, openness. The route operation insertion describes putting in a non-biological device into a body part. Dilation involves expanding an orifice or lumen, while bypass reroutes a tubular body part, and restriction partially closes an orifice. Remember that insertion is used for placing devices that remain in the body, such as stents or pacemakers. Question 5. Which reimbursement methodology is commonly used for hospital outpatient services and categorizes services into groups with similar clinical characteristics and costs? A. diagnosis-related groups, DRGs. B. Relative value units, RVUs. C. Ambulatory payment classifications, APCs. D. Resource-based relative value scale, RBRVS. Answer: C. Ambulatory payment classifications, APCs. This question focuses on understanding different hospital reimbursement methodologies. The keywords hospital outpatient services are crucial clues here. DRGs are for inpatient services, while RVUs and RBRVS are components of the physician fee schedule. APCs are specifically designed for Medicare reimbursement for outpatient hospital services, grouping them into categories for payment. Remembering that APCs relate to ambulatory, meaning outpatient, services can help you distinguish them from inpatient DRGs. Question 6. What federal law mandates the privacy and security of patient health information? A. Stark Law. B. False Claims Act. C. HIPAA. D. Anti-Kickback Statute. Answer: C. HIPAA. This question assesses knowledge of key healthcare regulations, specifically those related to patient privacy. The keywords privacy and security of patient health information directly point to the Health Insurance Portability and Accountability Act, HIPAA. HIPAA sets national standards for protecting sensitive patient health information from being disclosed without the patient's consent or knowledge. The Stark Law, False Claims Act, and Anti-Kickback Statute deal with issues like self-referrals, fraud, and illegal inducements, respectively, but not primarily patient privacy. Always remember HIPAA's core purpose is to protect patient health information. Question 7. A patient is diagnosed with metastatic carcinoma of the lung from a primary site in the breast. How would the lung malignancy be coded according to ICD-10-CM guidelines? A. As the primary site, since it's currently affecting the lung. B. As a secondary, metastatic, malignancy, with the breast as the primary. C. As an uncertain behavior neoplasm of the lung. D. As a benign neoplasm of the lung. Answer: B. As a secondary, metastatic, malignancy, with the breast as the primary. This question tests the specific ICD-10-CM guidelines for coding neoplasms, particularly metastatic cancer. The key phrase, metastatic carcinoma of the lung from a primary site in the breast, indicates that the cancer originated in the breast and spread to the lung. When coding metastatic cancer, the secondary, metastatic, site is coded first, followed by the primary malignant neoplasm, if known. Therefore, the lung malignancy is coded as secondary, linked back to the breast as the primary site. Remember that the code for the secondary site always comes first when the primary site is known. Question 8. A surgeon performs a complex repair of a laceration to the patient's right forearm measuring 5.5 centimeters. The wound involves muscle and required extensive debridement. Which CPT modifier would typically be appended to indicate that the procedure was performed on the right side of the body? A. -22. B. -59. C. RT. D. -51. Answer: C. RT. This question assesses the appropriate use of CPT modifiers, specifically for laterality. The keyword right forearm is the direct clue. Modifier RT indicates that the procedure was performed on the right side of a paired organ or anatomical site. Modifier -22 indicates increased procedural services, -59 indicates a distinct procedural service, and -51 indicates multiple procedures. When a code does not inherently specify laterality, anatomical modifiers like RT, right, or LT, left, are essential for accurate reporting and billing. Question 9. A patient receives oxygen therapy at home. What type of codes would be used to report the oxygen equipment and supplies? A. ICD-10-CM codes. B. CPT codes. C. HCPCS Level II codes. D. ICD-10-PCS codes. Answer: C. HCPCS Level II codes. This question tests knowledge of the different code sets and their appropriate uses. The phrase oxygen equipment and supplies refers to durable medical equipment, DME, prosthetics, orthotics, and supplies not covered by CPT codes. HCPCS Level II codes are specifically designed for reporting these types of items and services, primarily for Medicare and Medicaid claims. ICD-10-CM codes are for diagnoses, CPT codes are for physician and outpatient services, and ICD-10-PCS codes are for inpatient procedures. Remember HCPCS Level II for services and supplies beyond what's found in the CPT manual. Question 10. A patient presents to the emergency department after falling from a ladder at home while cleaning gutters. Which ICD-10-CM category would be used to report the external cause of this injury? A. S00T88, injury, poisoning, and certain other consequences of external causes. B. V00Y99, external causes of morbidity. C. Z00Z99, factors influencing health status and contact with health services. D. R00R99, symptoms, signs, and abnormal clinical and laboratory findings, not elsewhere classified. Answer: B. V00Y99, external causes of morbidity. This question focuses on the correct application of ICD-10-CM codes for external causes of injury. The keywords falling from a ladder at home directly describe the circumstances and external cause of the injury. The V00Y99 chapter specifically contains codes used to describe how the injury occurred, the intent, example accidental, intentional, the place of occurrence, and the activity of the person at the time of injury. Chapters like S00T88 describe the nature of the injury itself, while Z codes are for factors influencing health status, and R codes are for symptoms. Always report an external cause code to provide valuable data on injury circumstances. Question 11. Which body system is responsible for the exchange of gases, oxygen and carbon dioxide, between the blood and the external environment? A. Circulatory system. B. Digestive system. C. Respiratory system. D. Nervous system. Answer: C. Respiratory system. This question assesses basic knowledge of human anatomy and physiology, specifically the function of body systems. The keywords exchange of gases, oxygen and carbon dioxide clearly describe the primary role of the respiratory system. The circulatory system transports gases, but the respiratory system performs the actual exchange. The digestive system processes food, and the nervous system controls body functions. Thinking about the process of breathing helps solidify that the respiratory system is solely responsible for gas exchange. Question 12. What is the typical global period for a major surgical procedure according to CPT guidelines? A. 0 days. B. 10 days. C. 30 days. D. 90 days. Answer: D. 90 days. This question tests understanding of the CPT concept of a global surgical package. The keyword major surgical procedure is critical here. A global period includes all necessary services normally furnished by a surgeon before, during, and after a procedure. For major surgeries, the global period is typically 90 days, covering the day of the surgery plus 90 days post-surgery. Minor procedures often have a 0-day or 10-day global period, while some procedures may have no global period. Knowing the standard global periods helps ensure proper billing and prevents unbundling of services. Question 13. A patient is diagnosed with diabetic retinopathy with macular edema due to type 2 diabetes mellitus. Which type of ICD-10-CM code should be used to report this condition? A. Separate codes for diabetes, retinopathy, and macular edema. B. A combination code that includes all three conditions. C. A code for diabetic retinopathy, with an additional code for macular edema. D. A code for type 2 diabetes only. Answer: B. A combination code that includes all three conditions. This question assesses the application of ICD-10-CM combination codes, particularly for conditions with a clear cause and effect relationship. The phrase diabetic retinopathy with macular edema due to type 2 diabetes mellitus indicates that the retinopathy and macular edema are directly caused by the diabetes. ICD-10-CM often provides combination codes that include the disease, the manifestation, and sometimes the complication, especially for diabetes-related conditions. Using a single combination code, when available, ensures accurate and concise reporting. Always check the tabular list for combination codes before assigning multiple separate codes. Question 14. What does medical necessity primarily refer to in healthcare coding and billing? A. The most expensive treatment option. B. Services that are reasonable, necessary, and appropriate for treating a patient's condition. C. Any service requested by the patient. D. Services that are performed in an emergency setting. Answer: B. Services that are reasonable, necessary, and appropriate for treating a patient's condition. This question tests a fundamental concept in healthcare compliance and reimbursement: medical necessity. The core idea is that for a service to be covered by insurance and considered billable, it must be clinically appropriate and directly related to the patient's diagnosis or symptoms. It's not about the cost, patient preference, or even just the setting. Payers use medical necessity criteria to determine if healthcare services are justified and meet professional standards for diagnosis and treatment. Proper documentation is key to supporting medical necessity. Question 15. A patient undergoes an X-ray of the right ankle, 2 views, in the emergency department. Which CPT code category would this service fall under? A. Evaluation and management. B. Surgery. C. Radiology. D. Medicine. Answer: C. Radiology. This question tests the ability to classify CPT codes into their correct sections. The keywords X-ray of the right ankle clearly indicate an imaging service. Radiology is the section of the CPT manual dedicated to imaging services, including X-rays, MRI, CT scans, and ultrasound. Evaluation and management, E/M, codes are for physician visits, surgery is for operative procedures, and medicine covers a wide range of non-surgical services like immunizations and therapeutic injections. Recognizing the type of service performed is the first step in navigating the CPT manual effectively. Question 16. A patient is seen for a chronic scar from a previous burn to the left forearm that occurred 2 years ago. How would the scar be coded in ICD-10-CM? A. As an acute burn. B. As a current burn. C. As a sequela of a burn. D. As a complication of treatment. Answer: C. As a sequela of a burn. This question tests understanding of sequela coding in ICD-10-CM. The keywords chronic scar from a previous burn that occurred 2 years ago indicate that the burn is no longer active, and the scar is a residual effect or complication that arises after the acute phase of an illness or injury has terminated. A sequela requires 2 codes, one for the condition or nature of the sequela, the scar, and one for the original injury, the burn, causing the sequela. It is important to distinguish sequela from acute or current conditions. Question 17. In the Medicare Inpatient Prospective Payment System, IPPS, what is the payment unit for services provided? A. Individual CPT codes. B. Relative value units, RVUs. C. Diagnosis-related groups, DRGs. D. Ambulatory payment classifications, APCs. Answer: C. Diagnosis-related groups, DRGs. This question delves into Medicare's inpatient reimbursement methodology. The keywords Medicare Inpatient Prospective Payment System, IPPS, are the direct indicator. Under IPPS, hospitals are paid a predetermined amount for each patient admission based on the patient's DRG, which groups patients with similar diagnoses and resource consumption. RVUs are for physician services, CPT codes are for reporting services, and APCs are for outpatient services. Remember that DRGs are the payment unit for inpatient hospital stays. Question 18. A healthy patient visits their primary care physician for a routine annual physical examination without any specific complaints. Which type of ICD-10-CM code would be primarily used for this visit? A. NR code, symptoms, signs, and abnormal clinical and laboratory findings. B. AZ code, factors influencing health status and contact with health services. C. An S code, injury, poisoning, and certain other consequences of external causes. D. AG code, diseases of the nervous system. Answer: B. AZ code, factors influencing health status and contact with health services. This question tests the appropriate use of ICD-10-CM Z codes. The keywords healthy patient, routine annual physical examination, and without any specific complaints are clear indicators that this is a preventive encounter, not for an illness or injury. Z codes are used to report encounters for circumstances other than disease or injury, such as preventive care, screenings, or administrative purposes. An R code would be for symptoms, S codes for injuries, and G codes for nervous system diseases. When a patient is not ill but receives services, think Z codes. Question 19. A specimen of breast tissue is sent to pathology for examination. The pathologist performs a microscopic examination and provides a diagnosis. Which CPT code category would be used to report the pathologist's service? A. Evaluation and management. B. Surgery. C. Radiology. D. Pathology and laboratory. Answer: D. Pathology and laboratory. This question assesses the appropriate CPT code section for laboratory and pathology services. The keywords specimen of breast tissue, pathologist performs a microscopic examination, and provides a diagnosis all point to the pathology and laboratory section of the CPT manual. This section includes codes for services performed on specimens, such as surgical pathology, cytopathology, and chemistry tests. E/M is for patient visits, surgery for procedures, and radiology for imaging. If a specimen is being analyzed in a lab, think pathology and laboratory codes. Question 20. What does the prefix Brady- mean in medical terminology? A. Fast. B. Slow. C. Painful. D. Difficult. Answer: B. Slow. This question tests fundamental medical terminology knowledge, specifically common prefixes. The prefix Brady- consistently means slow, as seen in terms like bradycardia, slow heart rate, or bradypnea, slow breathing. Conversely, tachy- means fast. Understanding common prefixes is essential for quickly interpreting medical terms and selecting the correct codes. For example, knowing Brady- means slow helps you distinguish between different types of heart conditions. Question 21. In ICD-10-PCS, which approach describes a procedure performed by cutting through the skin or mucous membrane and any other layers of body tissue to reach the site of the procedure. A. External. B. Open. C. Percutaneous. D. Via natural or artificial opening. Answer: B. Open. This question tests knowledge of ICD-10-PCS approaches, a key component of inpatient procedural coding. The keywords cutting through the skin or mucous membrane and any other layers of body tissue to reach the site precisely describe the open approach. An external approach is performed directly on the skin or mucous membrane. Percutaneous involves puncture or minor incision. Via natural or artificial opening uses existing body orifices. The open approach is typically associated with larger incisions and direct visualization of the operative field. Question 22. When coding evaluation and management, E/M, services based on medical decision-making, MDM, which component reflects the complexity of establishing a diagnosis and/or selecting a management option? A. Number and complexity of problems addressed. B. Amount and/or complexity of data to be reviewed and analyzed. C. Risk of complications and/or morbidity or mortality of patient management. D. Time spent by the physician. Answer: A. Number and complexity of problems addressed. This question focuses on the components of medical decision-making, MDM, for E/M coding, as per the 2021 E/M guidelines, which are foundational for 2025. The component number and complexity of problems addressed directly relates to the physician's cognitive work in diagnosing and managing patient conditions. The other options, data to be reviewed and risk of complications, are also MDM components, but they address different aspects. Time is an alternative basis for E/M level selection, not an MDM component itself. Understanding these three MDM components, problems, data, risk, is crucial for accurate E/M coding. Question 23. Why is accurate and complete clinical documentation crucial for medical coding? A. It determines the patient's insurance coverage. B. It provides the necessary information to assign correct codes and support medical necessity. C. It dictates the patient's hospital stay length. D. It calculates the physician's salary. Answer: B. It provides the necessary information to assign correct codes and support medical necessity. This question emphasizes the critical link between clinical documentation and accurate medical coding. The keywords accurate and complete clinical documentation highlight its foundational role. Coders rely solely on the documentation in the patient's health record to assign the most specific and appropriate codes for diagnoses and procedures. Without clear documentation, it's impossible to prove medical necessity or select correct codes, which can lead to denied claims, audits, and compliance issues. Remember that if it wasn't documented, it wasn't done for coding purposes. Question 24. A patient is diagnosed with acute exacerbation of chronic obstructive pulmonary disease, COPD. How should this condition be coded in ICD-10-CM? A. Code only the acute exacerbation. B. Code only the chronic obstructive pulmonary disease. C. Code the acute exacerbation, with an additional code for the chronic COPD. D. A single combination code for COPD with acute exacerbation. Answer: D. A single combination code for COPD with acute exacerbation. This question tests the ICD-10-CM guideline for coding acute exacerbations of chronic conditions. The phrase acute exacerbation of chronic obstructive pulmonary disease indicates that the chronic condition is currently experiencing an acute worsening. ICD-10-CM provides specific combination codes for many conditions that have both an acute and chronic component, or an acute exacerbation of a chronic condition. These combination codes simplify reporting by capturing both aspects in one code. Always look for a combination code when a chronic condition is documented with an acute exacerbation. Question 25. Which coding initiative aims to promote correct coding and prevent inappropriate payment by identifying services that would not reasonably be performed together? A. Medicare Secondary Payer, MSP. B. National Correct Coding Initiative, NCCI. C. Health Information Portability and Accountability Act, HIPAA. D. Recovery Audit Contractors, RAC. Answer: B. National Correct Coding Initiative, NCCI. This question focuses on a key compliance and reimbursement initiative. The keywords promote correct coding, prevent inappropriate payment, and services that would not reasonably be performed together perfectly describe the purpose of the National Correct Coding Initiative, NCCI. NCCI edits, comprising procedure-to-procedure, PTP, edits and medically unlikely edits, MUEs, are developed by CMS to prevent improper payments for services that should not be reported together. HIPAA is about privacy, MSP about coordination of benefits, and RACs are auditors. NCCI is all about ensuring the right codes are billed together.